Hello, everyone. I'm Traci Arieli, end of life doula and founder of Comforting Closure. Welcome to another episode. Today, I am incredibly honored to have Isabel Knight from the National Home Funeral Alliance joining us. Isabel is a passionate advocate for home funerals along with the National Home Funeral Alliance. She helps empower families to take a more active role in caring for their loved ones after death. We'll be talking about the practicalities and benefits of home funerals, addressing common challenges, and discussing the growing role of death doulas in the funeral industry. We'll also explore important cultural considerations and critical issues like funeral debt. So grab your favorite drink, find a comfortable spot, and join us for this conversation. Isabel, welcome, and thank you so much for being here today.
Of course. Thank you for having me.
Could you start off by telling us a bit about yourself and your journey to becoming part of the National Home Funeral Alliance?
My background is actually in human-centered design, and so that's what I was doing as my sort of day job before I got into the death care space. And I was doing that in the mortgage space before, so a very different industry. And so I sort of joined the National Home Funeral Alliance, and this is years ago now, so I'm not even really quite remembering how I got connected with them in the first place, but I think someone had sent me just an email saying, hey, this group is looking for new board members. And so I applied and I was able to join in 2021, like July of 2021, I believe. And it's been an incredible journey these last few years doing this. We're an all volunteer organization. So doing all this volunteer work has been really gratifying. So that's kind of how I got into it. I know there's a lot of people who often have specific stories of, either home funerals that they've gone to or people that they know who've died, and that's kind of how they get into getting to do a doula training or something like that. But that was really kind of how I got into the space.
Well, happy anniversary. It's almost July, so that's coming up.
Yeah,
Happy anniversary. Uh,
thank you.
what are the primary goals and the mission of the National Home Funeral Alliance?
Yeah, so the mission of the National Home Funeral Alliance is to educate families, communities, individuals about caring for their dead. And so that can look like a number of different things. Like the definition of a home funeral is very expansive. One of the things that we've talked a lot about in the time that I've been on the board has been, whether or not it makes sense for us to use the word home funeral, because obviously there are some people who don't have a home. And so really any time that you are caring for your own dead in your own space, which isn't necessarily a funeral home, it can be a community space, it can be a somebody else's home, it can be a church or a synagogue, something like that. um, and so a lot of what that entails is performing your own after death care. So that can be shrouding, washing, that can be doing any kind of rituals that you would like to perform. And sometimes it also includes the help of a funeral director. There's 9 states where a funeral director is required in some step of the process, and usually that would involve transportation from a hospital to your home, or from your home to a cemetery or a crematory, or filing the paperwork. So there's a lot of states where you have what's called the electronic death record system. And so sometimes only funeral homes have access to that system. And so you need their help to file the death certificate.
How does a family even start to think about creating a home funeral? It's
Yeah.
definitely not the norm in our country.
Yeah, yeah. Um, well, it's a really complicated narrative because there are definitely some communities in this country that have always been doing home funerals, right? This is particularly common in various religious traditions, indigenous traditions, care for their own dead at home, many of them. And so it's definitely something that when we talk about like who we are and who the mainstream is in terms of what people are doing with their dead, I think there is this assumption that, there's a default of what we do and what we don't do. Um, I think that the the best thing to do when it comes to trying to plan your own home funeral is to start making a checklist of things that you're going to need to do. And this is one of the things that we at the National Home Funeral Alliance have a great resource to help people with. We published a guidebook last May that is like 150 plus pages, and it can guide you through all of the different steps that you're going to have to think about from, figuring out whether or not, for example, if you do die in a hospital, whether or not they have release policies that will allow you to take your person back home, and making sure to call them ahead of time to make sure that, they're home funeral friendly. Or if you're, for example, in one of those 9 states, or even if you're not in one of those 9 states that require a funeral director and you just want help from a local funeral director, finding those home funeral friendly funeral homes that can assist you in any part of the process. And I think mainly, especially if you're planning early, a lot of it is just building up the community, the people who are going to want to help you with your after death care, because that can be a really, involved conversation. And obviously not everyone is necessarily going to want to do that, but there are often, I think, times when people can be surprised at how many people who are already in their networks might be actually super interested in helping to wash and shroud. So a lot of it is initiating those conversations as well, with the people who might be helping you with that.
Two questions off of that. I know
Yeah.
that you just spoke of some of the challenges that people have, especially with maybe some of the hospice or hospital rules.
Mhm.
What are some of the other common challenges that people might face when they're planning a home funeral, and how can they navigate around those challenges? So that's the first
Right.
question.
I would say the number one challenge that people have is just that they don't know that it is legal for them to do at all. They don't know it's a possibility. And so a lot of what we do as an organization is just education around really basic, like this is an option that you have in all 50 states. And this is something that, does require a lot of planning if that's something that you're doing in advance. I mean, you can do it without doing pre-planning, but it definitely does just take a very motivated individual or couple people to really pull things together. One thing that I often like to say to people is that, planning a funeral can be as complicated as planning a wedding, and people take years to plan their wedding. So it's something that I really encourage people to, if that's an option they would like to take, start early. Those are some barriers. The hospital is a big barrier. And then also, like, there's a lot of people who don't necessarily know what paperwork they need. Like, for example, some people may be familiar with the death certificate, but then often people don't also know that you need a burial transit permit that, like, the cemetery or the crematory is going to ask you for once you get there, just to, make sure that you have permission to sort of be taking the body there. Um, so that's one thing. And also, there are definitely, even within, the people who are the cohort of people who graduate from mortuary school, there's even many funeral directors who don't necessarily know that home funerals are an option. And so, you might have friends or family who have gone to a funeral director who said, "Oh, this is totally not possible for you to do in the past." And so, a lot of what we also want to be doing is educating people in mortuary schools about what the actual laws are in each of these different states.
Thank you. You answered the second question. Thank you. You're that good. So, and I want to say that your guide, the home funeral guide that you have online, is a free download, everyone, and it is excellent. It is very easy to read, very instructive, and I appreciate it. So, a lot of hard work went into that. Thank you.
Yeah, of course. And we also really tried to make sure, in terms of getting illustrators and getting actual images to use to show people how to do things like closing the eyes and, closing the mouth and using like dental ties. Like there's all these specific things that I definitely didn't know how to do before I joined this organization. We tried to make sure that we were trying to get as representative a population as possible, represented in that book.
Thank you. Can you discuss how cultural norms and practices, particularly regarding embalming, intersect with the Home Funeral Alliance movement? I know we spoke about this before when we met.
Yeah, totally. So yeah, historically, the National Home Funeral Alliance has really sort of aligned ourselves with green burial practices and, sustainable death care practices. And, part of that is we used to have language on our website, that basically talks about how formaldehyde and embalming can be carcinogenic for embalmers and things like that, and like what the health risks are that is posed when you go with embalming. But since then, we've also heard feedback from people talking about the race and cultural implications around embalming. So, for example, there's particularly vulnerable populations that are more likely to die from traumatic deaths, such as gun violence or dying by suicide. And that is something that we really want to be really aware of when we're talking about basically trying to discuss different options without any kind of judgment. Because, yeah, I mean, if you're part of a community that's more likely to die of gun violence and you are more likely to need that reconstruction or that embalming, that's totally fair and something that we don't want to stigmatize, despite, you know, all of the other considerations around sustainability. So we've really moved towards a policy of really allowing people to choose what they want for themselves and not pushing people in a specific direction, whether it be around what disposition method they want to use, whether they want to choose embalming or not. But that's something that, we have evolved on since getting feedback around those sorts of practices.
Are there other ways that racism or cultural insensitivity um, shows up in the death care industry?
Oh, for sure. There's tons and tons of ways. And there's all kinds of efforts within the established funeral industry as well as, the more DIY scene or, the death doula space, what I kind of consider to be the alternative death care space within the death positive movement to talk about, for example, getting funeral directors training on how to do hair care, for example, for Black decedents, or how to do trans and non-binary body care. So, for example, like within the Jewish faith, when you do one of the rituals that they do after someone dies is a tahara, which is when you essentially wish a ritual washing of the body. And there's been conversations, within various Heber Kadisha, which is like the volunteer group within Judaism that comes when someone dies to help wash the body, um, around generally those tahara groups that will be performing the washing are split by gender. And then the question is, if this person is trans or non-binary, how do we staff those groups such that they if you can't find enough trans or non-binary people to be the person of the same gender as the person who has died, how do you handle that essentially? So there's so many of these types of questions, whether it comes to like racism, whether it comes to being LGBTQ friendly in death care, that people are definitely talking about within the death care space. And that's, true for the National Home Funeral Alliance, but also beyond the National Home Funeral Alliance in the death doula space and, in all kinds of death positive spaces.
When we spoke last, you mentioned that there has been a significant increase in the number of women entering mortuary school, now hovering just about 60%. How do you think that this will affect the funeral industry in the coming years?
It's actually even more than 60%. It's actually 72%. The 60% number was actually the percentage of current funeral directors who are leaving the funeral industry in the next
Mm.
5 years. And that is a huge shift. Like, I was really shocked to see that statistic. And there is this real influx of younger, more progressive, and especially women who are entering mortuary school that I think is really going to shake up the industry. I mean, it is an industry that has historically been, you know, basically most funeral homes are generally owned by white men. And this is something that I really see as a opportunity area in like the next 5 years in the funeral space, because we see so many people who are interested in joining these doula programs and becoming a death doula. And a lot of those people, I think, generally, obviously very broad strokes, but there isn't really actual data around that I've seen around how many death doula, what's the breakdown by gender. Other than actually, I have a survey where I publish a report on that, and like most of the respondents to my survey who identify as death doulas are women. And I think that that's really going to, I mean, historically, and again, this isn't like the full narrative, but prior to the funeral industry becoming what it is today, where, people go to mortuary school, like back in the times, pre-Civil War, when people were caring for their bodies at home, um, a lot of the, most of the time, that was considered women's work, right? And then we've sort of had a pendulum swing towards most of the people in the industry being men. And now we're kind of seeing this swing back. And so, what I would love to see is for the industry to really start thinking critically about how to incorporate this new wave of death workers who are coming in. Because what I would hate to see is all of these, really enthusiastic people entering into the industry and then sort of feeling like there are that basically getting demoralized because there are lots of legitimate complaints that I've heard from people who currently work in the funeral industry where like it can be you can be on call 24/7 and the pay isn't necessarily super high and you might not get the benefits at the level at which you want to see. So I mean that's something that I would really love to see the established funeral industry start thinking about how to handle. And that's something that those conversations have been happening. Back in March, there was a law symposium held by Wake Forest Law School. And one of the big topic areas that they had a panel on was, the staffing crisis within the funeral industry and how are they going to deal with some of those staffing shortages. And, one of the main things that they brought up is this dual tracking of right now, in many states, it varies state by state, but the embalming role and like the funeral director role is considered sort of one role. And embalming, where you're actually doing those procedures, with the hands-on body care is often sort of a backroom activity. And being a funeral director is more like event planning, which is a very sort of front-facing, client-facing activity. And so people have been talking about, can we sort of split those things into two? Do those people necessarily have to be the same person, and sort of go this dual tracking route? Um, which is I don't even actually really know who like how they make those decisions, but is that a possibility for the established industry to start thinking about what are the barriers to entry to people getting into the funeral director role? There's also a lot of states that have these ready to embalm laws that say even if you are not a funeral home that does embalming, right? So like for example, Jewish funeral homes, Muslim funeral homes, that's not an accepted practice within those traditions. And so they are often required to have an embalming room within their funeral homes, despite the fact that they don't offer it. So there's like a lot of these pieces of legislation and policies within the industry that don't necessarily serve people as well as they could be serving them. But also, I mean, I, as a consumer advocate, would also really like to see more transparency from the industry because I don't think it's just these barriers to entry. I also think that the industry definitely has an optics problem where so many people think of the established funeral industry as being really opaque with their pricing because, especially right now, um, the FTC is evaluating the funeral rule, the one main legislation within, the funeral space on a federal level, and they are evaluating whether or not they should require funeral homes, among many other things, whether they should require funeral homes to post their prices online, have that mandatory price transparency, and many funeral director representatives, including the general counsel of the National Funeral Directors Association, have really strongly pushed back against those types of regulations. And I think that from the consumer perspective, when people in the death positive space see them doing that, I think that furthers that optics problem, right? Because it poses this as this oppositional thing between the funeral homes trying to, you know, be very sort of closed about their prices and not necessarily being as transparent as they could be, and the consumers who obviously want to have more information so that they have the ability to price shop. I mean, I say this all the time. A funeral is the third most expensive thing that the average consumer will buy after a house and a car. And you can go look up house prices on Zillow, right? Like people have lots of familiarity with how much a house should cost and how much a car should cost. But that's not something that currently people can do in the funeral industry. And the reason why I think this is also so important is because you are not legally required to buy a house or a car, but you are legally required to buy a disposition method. You are required to buy a funeral essentially because you can't legally just dump a body in the woods, right? You can't opt not to buy this particular service. And so that's why I think this should really be considered a different category of good that should be have a higher standard of regulation. Because one of the things that funeral directors have said is that, well, if you go to the dentist, they're not required to disclose prices. If you go to a lawyer, they're not required to disclose prices. But this is a very different sort of type of good that you are legally required to buy.
Right. So I want to talk about two things. First, let's talk about funeral debt because I'd never heard that term before meeting you, and it's really a scary term. And then the second thing, I want to talk about how the relationship between doulas and the funeral homes, what that relationship is like and why. So let's talk about funeral debt before. And as I said, before I met you, I'd never heard of that term. When you told me, I was like, wow, I've heard of college debt, but
Right.
not funeral debt yet. So can you talk about the costs associated with a traditional funeral versus a home funeral and how people can manage debt, funeral debt, and hopefully avoid it?
Yeah, totally. So the typical funeral, and this is actually based on data from the National Funeral Directors Association. So this is kind of the numbers that the funeral industry gives themselves. And it's always going up, but based on 2023 numbers from the National Funeral Directors Association, the typical funeral, the median funeral, um, including a vault, is about $10,000. Technically, $9,995. And we also see headlines around the average American can't afford an emergency that costs them like $400, right? So this is clearly something that if someone dies unexpectedly, and this falls in the category of one of those emergencies that you have to pay for, that most people don't necessarily either can't pay for or would have tremendous financial stress that would be caused by, an unexpected death in their family. Um, for example, during COVID in Philadelphia, where I live, if you went on GoFundMe at the height of the pandemic, more than half of the GoFundMe's were for funeral expenses. And this was even while, during that emergency period, Congress did authorize FEMA money to go towards funeral expenses for people who had died of COVID. And even then, right, you were seeing so many GoFundMe's, and obviously, when people have to resort to that kind of crowdfunding, you still see, those. I'm glad those platforms exist, but they still mirror all of the same inequities that exist in the established systems, right? If someone can't write as compelling, a page for their GoFundMe, like they're less likely to get the money that they need to cover their funeral expenses, and those people end up going into debt. And so that's something that I think that I would love for us to have more data on. Um, but that's a serious problem in the United States. And the only real option for people who have like no money at all is to go through, there's many cities, counties that have systems for, people to go through who are considered unclaimed, right? Where you don't have to pay anything. But that is such a wide disparity. There's so many people in the middle who kind of who fall through the cracks, basically.
It's unfortunate and really unfair.
Right. And even that FEMA money, I mean, that's not still a program that's going on. So people right now are still pretty much on their own to find the money, to pay for funerals. But even then, that money wasn't going to families. Like that was going directly to funeral homes. So like all of these even progressive policies, right, aren't still addressing, like those funeral homes can still charge whatever they want, right? And because there isn't very much price transparency, those are still super high prices for the average consumer. And what we see in other countries that implement these price transparency guidelines, so for example, the UK implemented this exact policy that our FTC is currently evaluating whether or not they're going to implement or not back in 2021. And what we saw when they implemented those laws was that for SCI, Service Corporation International, the largest sort of funeral conglomerate that operates here in the US, also known as Dignity Memorial, prices went down by a third.
Well, that says a lot. It says
Right.
a real lot.
I definitely, part of why I advocate for home funerals is because there is an option for it to be more affordable. Like technically speaking, right, if you go with the absolute bare minimum route, if you want to do a viewing at home, you might need to get some ice to put, basically preserve the person at home. Um, and all the rest of it is truly, you know, basically down to um, the main rest of the expense that you would need is the cost of your disposition method, right? So if you're doing a direct cremation, if you're doing an immediate burial, like that would often be the minimum possible cost. And that's assuming you're not going through, the system that you might have locally for unclaimed bodies. In that case, it would be free, or if you were going through a body donation program where you're donating your body to science, for academic purposes, for some of these medical schools cadaver programs, that's also a free option. So it does dramatically, lower the cost for people for whom that's the reason they're doing a home funeral. Obviously, there's plenty of people who can do super elaborate home funerals if that's what they want to do. But that is something that, in our guidebook, we kind of do a cost breakdown of, different scenarios. If you're doing like the bare minimum, what would you have to pay for? And then something that's sort of in the middle, and then, some more elaborate service, for example.
Now let's round back to the relationship between death doulas and funeral directors or the home funeral industry. I know from experience that there is contention
Right.
between us. Why do you think that is?
Yeah, so your audience might be familiar with this, but in the last few years, there have been two big legal cases in the funeral space where mortuary boards have been suing death doulas for quote unquote practicing funeral directing without a license, right? So there was one case with Full Circle Living and Dying in California, and there was another case more recently with Lauren Richwine of doing death differently in Indiana. And in both of those cases, they were represented by the Institute for Justice, who represented them pro bono, and it essentially came down to the First Amendment. Essentially, were they able to talk about end of life planning with their clients? And we've seen a lot of success in the both of those cases, in terms of the courts basically saying, yes, you can, talk to people. This is your First Amendment right to do this kind of death education. And so I think a lot of the reason why we're seeing those lawsuits come forward is because funeral directors, and not all of them, there's definitely lots and lots of funeral directors that I know, who are really interested in incorporating death doulas, into the more traditional established funeral industry. But there are many funeral directors who see it as somewhat of a threat, because they want to do the pre-planning themselves. They don't necessarily want to see death doulas, helping families and individuals and communities pre-plan. And so what I would love to see is, a real conversation with people in the industry and with people in, the death doula space on what real collaboration could look like. Because in my mind, when we look at this staffing crisis that the funeral industry has been really open about, like we are about to see we're about to have some real issues in terms of being able to staff all these funeral homes. And this is something that I wish was talked about with a little bit more urgency, because this is not something that's optional, right? Like we know, demographically speaking, that until 2035, the number of people who are going to be dying each year is just going to go up. That's sort of like the peak of when people are projected to be dying in the United States. And if we don't have the infrastructure, which we don't currently do, to handle that number of people. Like we saw during COVID, crematories, crematories are not intended to be running 24 hours a day, right? They need a cool down period. And so crematories were breaking down. Here in Pennsylvania, in Philadelphia, we were getting people, shipped from New York because New York was experiencing a huge influx, of people that they just didn't have the capacity to handle with the, infrastructure that they have there. Um, and so I really believe that death doulas could be a huge key to addressing the staffing crisis that the funeral industry admits that they have,
Yeah.
right? And so I would love to see real creative, open conversation happen around how that could happen because there's definitely death doulas, and I would be really curious to hear your perspective on this as well. I mean, I feel like I know so many death doulas who very much, and the way that it's framed in these trainings that people go to, obviously they're not all the same, but I feel like many of these death doula trainings frame it as the kind of thing that you then go do as an independent practitioner yourself, essentially as a freelancer, or perhaps as part of a collective. And what I would love to see is, how can we actually be talking about, in my mind, the most sustainable way to truly incorporate death doulas is incorporating it as part of the current infrastructure, right? So like hospitals employing death doulas, funeral homes employ death doulas. I know of one elder care attorney that employs a death doula. Seeing what are the adjacent spaces where death doulas can be incorporated on this sort of structural and institutional level.
Yeah. I would say that there are, I mean, ideally, that's wonderful. That's one, but I think a lot, including myself, a lot of death doulas might not like why we freelance or have our own companies is because once you start being part of the hospital or part of the other industry, it becomes very medicalized, right? You have, we saw this with hospices where, in the 1960s and 1970s, when those started to, really become front and center, that it was a very different than it is today because insurance got involved. And so, the hospice nurses used to be able to spend a lot of time with people, and now, hey, it's they have to rush. They have a quota to meet, and so there are all these rules and regulations that do not benefit the client. And so what the doula is actually trying to do is educate and to support the family to really help with the fear that the family and the person who's passing away is going through. And I think that if we are forced or we are part of the hospital, that's going to change drastically. And I don't want to see that change. So that's, I think, part of why you see this tug of war. That's my own personal reflection on it. And I've talked to a couple other doulas. But the same thing's happening with the birth doula area too. Many people are like, no, we don't want to accept Medicare because of that, of not really being able to take care of the client. So that's where you might see it. But I do agree there needs to be a partnership between the funeral industry, death doulas, and even hospitals and hospices, because we could be that bridge, really, that takes the family from illness through death and through then disposition, where hospice doesn't do the disposition, the funeral industry doesn't, they're not, walking hand in hand with the family. So that could be a really good bridge for people to take care of families and people.
Totally. And I really do, in this conversation that has been had in and is ongoing in the death doula space, this question around should death doulas be more highly regulated, and should it be something that, kind of goes the way, that therapy has gone, that hospice has gone, that has allowed it to be sort of more institutionalized because it has that regulation and standardization. I do really have a lot of sympathy for this argument that, like, we don't want to have to, be beholden to various rules and regulations around things like, not being able to disclose things about myself to my client. Like, I want to be able to have this really intimate relationship with the people that I'm working with. Or, would then doulas be subject to mandatory reporting around, like, for example, recently I have a doula friend who had a scenario in which, she was helping a family who, the partner was sort of like, okay, when this person dies, I'm gonna kill myself, right? And that in a medicalized system would be subject to mandatory reporting. That's real. That's a really complicated situation to deal with,
Yeah.
right? And I totally think that it's super legitimate for people to be wary of that kind of regulation. But also, I also see a lot of, legitimate people, I think there's also a very legitimate argument to be made that, like, how do we deal with this access issue of people actually being able to access this kind of care? Because, there's definitely people who offer sliding scale, there's definitely people who volunteer, but I do think at the same time, there's a lot of people who would like to see this become a real job, that people can be doing full time,
Yep.
and not just something that you can do if you're already independently wealthy and you don't need the money,
Yep.
right? Because that's like its own set of issues from an access standpoint. It's just a function of who can access the care, on the demand side versus who can provide the care on the supply side,
Yep.
right? Those are both, I think, two legitimate issues when it comes to who gets to access the work and who gets to do the work,
Yep. I
right?
I totally agree, and that is the big tug of war. We
Right.
spoke about this before. It is a real
Totally.
huge tug of war. And
And I also think that, one thing that sorry to interrupt, but I feel like it is also, I think, legitimate for people in hospice, in the funeral industry, like, for people in the established industry essentially to say, hey, like, there are actually things that can go wrong, right? Like, there's definitely people, and I think, historically the National Home Funeral Alliance has really taken this stance of, like, oh, like, people are way too protective of telling families and individuals what they can or cannot do, right? And that's something that, we definitely are trying to push in the direction of being like, actually, people totally can handle this. People can be empowered to do home death care. Like, that's 100% something that people can do. But I also definitely, when we have these conversations with people in industry, I also really understand, right, when people, I recently was talking to somebody who is part of a transport company, and he was really, really against the notion of home death care because he was like, you have no idea how many people I've had to go pick up who, have been, who were dead for weeks, right? And, I had to pick up this person who was in a very advanced state of decomposition, right? And, like, a lot of the negotiation is figuring out how to talk to someone who's had that experience, which I'm sure was traumatic for him, right? And say, that's not every experience, right? There is nuance here. There is a middle ground where there is, a period after someone dies when they're not in a state of advanced decomposition, when it's totally valid for families to do their own death care at home.
yeah. So let's switch over to that family, the family death care in the community. And
Mm-hmm.
I know we used to do death care in the community. Death 200 years ago was very different than it is today. How can communities build and support a network that allows for community death care?
Yeah, so that's something that I'll tell you what we're trying to do here in Philadelphia.
Please.
So we have a group called Philadelphia Community Death Care that's just, a bunch of local volunteers. And some of them are death doulas, some of them are not. Some of them are just literally, I mean, essentially, I recruited a lot of the people who are in the group because we did a shrouding um, public event back in November where we had a local funeral director come, and we laid out a massage table and we just taught everyone how to shroud. And it was a really, really, literally the only real way we advertised this event was like flyers, which in Philadelphia is actually really effective. Not necessarily effective for every community, but here, like, the flyers really work. And, you know, it was really, really great to see how many people just off of a flyer wanted to show up and do this hands-on shrouding event and learn how to shroud and do this like, community death care activity. And so from that, the group has really grown, and we've been doing like educational, events for the community. We've been showing movies, we've been doing all kinds of stuff. Um, but I would really like to, and it's a very nascent group. Like we haven't actually started doing any like hands-on death care for people in the community yet. But my goal for the group, what I would love to see is as we become more comfortable with each other, that we can start fielding calls from people in the community when someone dies and says, hey, like, can a group of volunteers show up and help us, to deal with to help wash and shroud and do any other death care activities for, this person who's died. And that's something that I think involves a lot of like talking to the medical examiner's office, talking to, different religious groups, and, just like really embedding yourselves in the community to say, hey, we're a resource that is available for free, right? Whether that's like we have local area agencies on aging, like there's so many elder care organizations that are specifically targeted towards people who are low income, or people who just like need help within senior communities, um who have, when we talk to them, really really see the value of having a group like this, of people who are just willing and able to show up and help people care for their dead. And that's something that there's definitely other places in the country that have models like this. Um, Wake is a group in New Orleans that does community death education and death care. A Sacred Passing in Seattle. The Janaza Project is a Muslim group that does this, that has an all volunteer part of their organization in New York. And so there's definitely different flavors of what this looks like in different parts of the country. But I think fundamentally, it's like getting a group together of people and saying, hey, like this is something that not only is a really needed in the community, but it's also, as a volunteer, something that's really gratifying work to do.
You just spoke about, hey, if we do this community death care, we have to talk to the coroner's office, the hospitals, the doctors. How do you collaborate with other organizations and professionals in the death care industry to, support the home funerals? Yeah, what does that look like?
Totally. So, like, for example, we recently talked to people who were part of the medical examiner's office here in Philly, and they told us that, for their free, we have a city free cremation program, right? And one thing that's actually really awesome about our cremation program in Philadelphia is that they actually allow people to get the ashes back afterwards, which often doesn't necessarily happen because they're considered unclaimed, right? But you can show up at the medical examiner's office and get those ashes. And so for people who don't, we asked them, what are some ways that our group can help you guys? And they said that, for people who can't physically come to the medical examiner's office to pick up the ashes, is there a way that our group can actually facilitate either mailing the ashes to people, or, picking up themselves and dropping them off at people's homes? So like that's one example. There's lots and lots of examples of, just for I would love to, explore more is like, I think a lot of religious groups have this sort of down, like they have like, structures in place to figure out how to do some of this community death care already. But how do you do this in secular communities, right? I was talking to a rabbi recently who was like, I don't understand how secular people do this. Like there's so much structure that goes into, and like labor that goes into what we do in our community. And, I would love to see us build up the infrastructure to see that happen in a secular context,
Yep.
you know?
Yeah, I agree with that. I 100% agree. So, well, before we leave, because we're almost at the top of the hour, is there any advice you'd like to give families who are looking into doing a home funeral?
Yeah, I mean, definitely check out the guidebook that we published. That's why we publish it, is to help people who want to be able to do this for themselves. We also have a podcast where, I mean, I think it's one thing to read a manual essentially on, like, how to care for a body, but it's totally another thing to hear people's stories of someone who's done this for themselves and just hear the emotional impact that it can have for people. I mean, we have a podcast called A Path Home, and it's all stories of people who have done community death care themselves. And I don't necessarily tell people that, like, in 100% of cases, like, this is going to help you in the grieving process, but there definitely are so many people who really get a sense of closure and a sense of healing from being able to care for their own dead. And it's definitely something that, like, for most people that I talk to, if they've never heard of this before, has a bit of a, like, kind of scary, potentially icky reaction for people. But then once you, like, really think about it and you hear stories of people who've done it before, I think a lot of people really warm up to the idea. And obviously there's people for whom, like, if this has been your cultural practice, like, like, nobody needs to sell you on it. And so I really would recommend talking to people in your community, and, like, if you don't have people in your community who've done something like this before, going to, our podcast and listening to stories of people who've done this. And, obviously listening to your podcast, because, you have definitely stories like this too, where people, it's just so hard to communicate until you've, like, really heard the story of someone who's done it. Right. So I would just say seek out those stories.
Yeah. I think that home funerals are so helpful in that sense of closure, as you said, for two really large reasons. One, there's that sense of community, and we all know how healing community is, and also it's a ritual, and there's creativity that goes into that, and there's just something very basic, very grounding about doing
Yeah.
something like this.
And that's such a classic thing that you hear too. When people die, people often don't know what to do. It's hard to know how to support people. We become so alienated in our, capitalistic culture. Like, we don't know how the sausage is made. Like, it's so divorced from our day-to-day lived experience.
Yeah.
Right. And I think that this can also just really help people, even if you're not literally doing hands-on body care or doing a viewing or, like, seeing the body, just giving people an opportunity. Like, yes, it's more work, right? Most of the time, it's going to be more work than just paying a funeral home. I mean, that's why it costs $10,000, right, to pay a funeral home to do this. But giving people something to do that's like, I am actually really helping the family, the closest circle of people, the community who are really grieving in this time, to by actually showing up and doing whatever it is you're doing, being part of the phone tree, helping people park outside the house, like, just basic things like that that don't have to necessarily be the most intense, like, let me wash this person's body, is still really, really helpful for people.
Yeah, yeah. And you're either going to be doing that work on the front end or the back end.
Or later, totally.
Yeah, or later. And this really helps internalize that grief and really helps move through that. So it's really, you can do it now, you can do it later, and you will do it later again and again and again, but it's it's a big difference, right?
Totally.
Okay, great. So, Isabel, thank you so much for being here. It's been a pleasure. How can our listeners learn more about and support the National Home Funeral Alliance?
Yeah, absolutely. So, we take donations. So you can definitely donate to our work if this is something that you, even if you're just hearing about it now, like, feel passionately about. When you download the guidebook, there's an option to do that. But also, really, we are constantly, looking for people to just talk to the people in your life about this. I mean, I advocate talking about end of life generally and, like, having conversations about death generally, but, like, letting people know that this is something that they can do for themselves or in your own plan, just spreading the message far and wide. And another thing I'll say is that we are in partnership with many other death care nonprofits. And this September, we're actually putting together a super conference with three other death care nonprofits, the Funeral Consumers Alliance, the National End of Life Doula Alliance, and People's Memorial Association. And I would love to see people there. And that's really a conference that's geared towards practitioners in the funeral space who are, whether you're a doula, you're a home funeral guide, you're, a funeral director, people who are doing this work and having some of those conversations that we mentioned in this podcast around what would we like to see. We have a panel on the regulatory environment and, what is the legal precedent that's been set? How is that going to affect the industry, right? How can we improve access? How can we improve representation and diversity in the industry? So those are some of the topics we're going to be talking about, and I would really, really love to see people show up and be part of the conversation there.
Do you have a date for that yet?
Yes, it's going to be the weekend of September 27th through 29th. So most of the programming is happening that Saturday, the 28th.
Great. And what city is it in?
Seattle.
Okay,
It's going to happen
wonderful.
at the Seattle Public Library.
There's a lot of things that happen in death care in Seattle. I don't know what that says about Seattle, but there's a lot there going on there.
Oh, I do think that a lot of it has to do with, like People's Memorial, which is based in Seattle, has been around for like 100 years, right? And that was sort of one of the precursors to the Funeral Consumers Alliance. There's a lot of history, so I could tell you a lot about
We'll
why
have
that
this
happens. But yeah,
conversation,
yeah, totally,
offline and
yeah,
wonderful. But thank you so much for being here. I appreciate it.
yeah,
Folks, most people don't realize that home funerals are a viable option. The work of the National Home Funeral Alliance highlights the impact that compassionate and community center approaches can have on our experiences with death and grieving. By taking control of the post death experience of our loved ones, we can create more meaningful, personal, and healing farewells. Thank you for joining us. If you have any questions, please comment below or reach out to me directly. And if you found this conversation to be helpful, please like, share, comment, and subscribe. This is Traci Arieli from Comforting Closure, wishing you peace and comfort in your journey. Until next time, take care.